morning, everyone. This is Bill Miles with the Hilton Head Island Bluffton Chamber of Commerce, and we're delighted to have you with us again this morning. We have a stellar lineup of thought leaders today, and we're going to be talking about everything from what it was like to be inside the Capitol on January 6th to where we are in the vaccine deployment process. I just want to remind everyone that our goal continues to be to convene, convey, and connect our community. And that need still remains as we head into what is hopefully the home stretch of the pandemic. And I'd also like to give a shout out to Scott Grooms and the Beaufort County channel. Once again, they're broadcasting this on the county channel, which really allows between 800 and 1,000 more people to be hearing each time we do this. Also want to thank the town of Bluffton as well as the town of Hilton Head Island for promoting this on their social channels as well. We're going to get right into it this morning. Again, a stellar lineup, and our first guest certainly knows her way around our nation's capital. And Tori Barnes is the Executive Vice President of Public Affairs and Policy for the U.S. Travel Association. If you're not familiar with the U.S. Travel Association, their mission is simply succinct, it's straightforward, it's important to all of us, and that mission is to increase travel to and within the United States. She leads their government relations efforts on behalf of the tourism industry, and prior to her role with U.S. Travel, she served as a member of General Motors' Federal Affairs team for over 14 years. Tori is a friend and certainly works tirelessly as an advocate for the tourism industry, and we're pleased to have her on the call this morning. Tori, welcome, and thank you for dialing in this morning.
Thanks so much for having me, Bill, and asking me to join this important series. And of course, I wish that we could be together in person, as I know we would all like to be right now. But you have been such incredible supporters of U.S. travel and our Let's Go There campaign as well, which has been extremely successful thanks to your engagement and leadership. Hilton Head area and Bluffton, such a great advocate for our industry. We really are grateful for your partnership. So I'm excited to be here today. And for those unfamiliar with U.S. Travel, we are the leading nonprofit association that represents travel businesses of all sizes across every sector of the industry. I head up public affairs and government relations, and our focus has been to grow travel to and within the U.S. Right now, we're focused really on building back the industry stronger than ever. 2020 was a challenging year. I think we all know that, and the data shows why we need to continue to fight for additional relief and stimulus. 39% of all unemployment nationwide is in leisure and hospitality. Travel spending is down nearly $500 billion. We did make great progress last year, a lot of accomplishments on the legislative front. I think if we go to the next slide, you can see some of the things that we were able to get across the finish line. Obviously, the Payment Protection Program is a big one, and we fought very hard to get DMOs, the quasi-governmental, and 501c6 nonprofits included in the PPP. But in addition to that, extending the coronavirus relief fund, employee retention tax credit, economic injury, disaster loans, live venue grants, and airport funding were all included in the bill that passed at the end of last year. One quick note important that starting today through March 9th, businesses with 20 or fewer employees have an exclusive period for application processing through SBA and the PPP loans. And so after the 14 days are up, they'll resume first and second loans, but the program does end at the end of March. So that's one of the things that we will be continuing to work to extend. We obviously think that bill was a bridge into what we need to do to drive a greater recovery for the industry and ultimately the country. Congress and the administration are currently working on a bill. I'm sure you all are well aware. The House will vote on the bill at the end of this week. But A couple things not included that we are going to continue to work to include either as a standalone bill or in the next moving bill are extending PPP through the end of this year. We'd also like to see a third draw for those businesses that have been hardest hit, which obviously our industry falls into. We should note that there is additional money going into PPP in the current bill, but not extension of that deadline of March 31st, which is when it currently expires. We also are seeking a tax bill, which will be reintroduced either later today or tomorrow. It would provide temporary tax incentives for leisure and business travel to help boost and accelerate rehiring. Included in that tax package is also a meetings and events tax credit, a restaurant credit, and credit for expanding the employee retention tax credit. So a lot of good things in there for travel businesses. Again, we'll be introducing that in both the House and the Senate later today or in the morning. We are also working very closely with the administration. We are off to a pretty good start. We've shared our priorities for the administration's first 100 days to really define a plan to restart both domestic travel and safely reopen international inbound travel. You can see here on the screen some of the approaches that we're proposing. And we are also really supportive of the administration's mask mandate and their vaccine distribution plans to enhance the vaccine distribution. We also, really think that mask mandate helps to add that additional layer of health and safety, which is so critical. We put out health and safety guidance earlier in 2020. And one of the important points, I think, on wearing a mask and on following those health and safety guidance is that we really want to ensure there is not any requirement to test or to be vaccinated to travel. So we don't want to have any hindering of the ability for folks to move around domestically. So we pushed really hard recently against the administration's potential consideration of a testing requirement. And we came out in a good place there when they made their announcement late last week that they would not pursue a domestic testing requirement. And so, everything that we really looked at in that health and safety approach has been based on scientific and data-driven risk assessment and wanting to ensure effective, feasible, and scalable solutions that can allow, a net positive benefit for public health and avoid unintended consequences, but really continue to be able to have folks travel. And so we must remain vigilant, I think, continuing into our work with the administration to ensure that we don't have any policies that could unintentionally cause a deterrent to travel and to our recovery. I'll make a quick note real quick on business travel. Obviously, we know that we need to be able to welcome back business travelers. One of our priorities is returning to in-person meetings. We're actually hosting a hybrid in-person event in 2 weeks for our board meeting. And we are working with the Let's Meet There coalition, really focused on this revival of business travel meetings and events, working alongside U.S. Travel's Meetings Mean Business Coalition. And at the end of the day, what we are working to do is really demonstrate to the CDC that structured meetings and events are very different than mass gatherings, and that in a structured, organized way, we should be able to increase gathering limitations across the country and get back to meeting in person. I want to also just note, while we do have a lot going on here in the near term, we also are really keeping in mind the long term and what is on the horizon. So we put together a Power of Travel policy platform to lay out priorities to guide over the next 4 years to regrow the industry. And really, there are 5 areas that we're looking at. 1, the importance, obviously, of economic recovery measures. 2, investments in infrastructure and the future of travel mobility. 3, enhanced travel facilitation programs, increasing our global competitiveness, and reimagining the air travel system. We all have a role in writing travel's next chapter, and we are continuing to fight for relief and recovery, we also want to have our eyes on how to really reimagine our travel ecosystem and bring us back even better than ever. I'm happy to answer any questions as well, but first I would love to extend an invitation to y'all. We will be advancing our key priorities and legislative asks at Destination Capitol Hill, which is our annual fly-in. We will take that virtually this year. It'll be Wednesday, March 17th. We may have an in-person fly-in in the fall, depending on gathering limitations in DC. But in the meantime, this is a great opportunity on Wednesday, March 17th to join hundreds of your colleagues, really ensure that we are pushing travel priorities in Congress through direct conversations with lawmakers like Congresswoman Mace. And registration this year is complimentary. You can visit our website at ustravel.org to learn more about it. And then finally, would love to ask you to join us for National Travel and Tourism Week, the week of May 2nd to 8th. This is an annual tradition to unite really and celebrate the value that travel holds for economy, businesses, and well-being. And this year's theme is the power of travel. So we really think that it's a great way to demonstrate what we're doing and show in tangible ways how important travel industry is to the greater economy and our ultimate recovery. So thanks again for having me today. So grateful truly for all that you do, Bill, and all of you for the industry. And I'm again happy to answer any questions or chat after as well.
All right, Tori, thank you so much. We do have a few questions for you. And the first one's coming to us this morning from Linda. And Linda is asking if you have any information on the tip credit legislation. It will eliminate tip credit for servers, waiters as part of the recent bill.
So I think that's in line with the minimum, the attempt to raise the minimum wage. And it's unclear right now about how that provision is going to move forward. There is a lot of opposition to raising the minimum wage and some of the issues around that. And right now, I don't believe they have the votes in the Senate to proceed on that. But I know that the administration is working very aggressively to try to gain support. So I think that one's still to be determined. But happy to follow back up as things progress here over the next week or two.
All right, thank you for that. The next question is coming from Phil. And Phil is asking, how will Canadian restrictions impact their inbound travel to the U.S.?
So, we still have the travel restrictions in place. We have been working closely with the administration to encourage them to lift the 212F travel restrictions. Obviously, there is a reciprocity component to reopening, and in particular, the Canadian inbound travel restrictions are quite strong with a 2-week mandatory quarantine in a government run hotel, if you will. And so, we continue to really try to compel the administration to understand the economic consequences of not reopening these international borders. And so continue to try to share data with them, working closely with the airlines in that regard as well. So I think it's still something that will require a lot of engagement from the industry, and we'll be back in the short term with some more aggressive actions to try to rally the troops to compel the administration again to reopen internationally.
All right, thank you for that. The next question is from Amy, and Amy is asking, saying that the H-2B visa issue is very important to our workforce, and where do you see legislation headed on this topic?
Yeah, so there is a lot of support for the H-2B. That's something that we are on the record with as well in this administration. I think that there will be, that there will be some more recognition and support for H-2Bs in this administration. I think that we still need to compel, though, and help the administration kind of fully understand why, with so many unemployed within our industry, why those H-2B visas are still so critical. So that's something that we are having conversations with them about. But I do think, again, that there's greater support and understanding on the importance of those workers and getting those visas than there was in the previous administration. So I don't have a time horizon for you, but it is something that we're working on and hope that it can be in the first part of this year.
Thank you for that. I want to tell our listeners this morning, I remember back in, I think it was March or maybe early April, and I was on a Zoom call watching you and Roger and U.S. Travel on an update. And as professional as Tori is and everything that she does, her daughter pops into the background of the screenshot. It was just so funny, and you handled it well. But we've all seen that as the year has progressed with COVID and the pandemic. And anyway, that was just a funny memory that I have early on from Zooming with you and U.S. Travel. Another question, Tori, is coming to us from Tim, and Tim is asking, what are some of the most innovative things you're seeing from hotels on how they're meeting the need of hybrid meetings?
Sure. So, they are doing, a lot of really good work, I think, in just getting creative with some of the boxed lunch offerings, I think helping to build that confidence on sharing, wiping down the podium. I think, kind of getting creative with, fun music. But I think little tchotchke things that folks are their individual, hand sanitizers and masks. But I think as far as what we've done here before they in DC, at least 2 of the hybrid meetings that I attended were really well done and really creative. But we haven't really been able to have those in the DC area in quite some time. So, I'm excited about our upcoming board meeting where we are actually getting kind of creative. We're going to have little stickers, that kind of indicate, a red, yellow, green on your your receptivity to, are you open to hugs? Are you, fist bumping or, elbow touching? Or are you, please stay 6 feet away. I'm in the red zone. So that's something that I know that we're looking at and other people are trying to get creative on. But I think that the hotels generally are just really, because they really want to bring back those meetings and events, doing everything they can to demonstrate strong confidence in cleanliness measures and helping to keep folks safe. So, I think we'll continue to see some creative and innovative approaches to getting folks back. And again, I think as we look at that layered approach to health and safety, we'll continue to see some fun ways that people can get together, but still be, recognize the health risks that are there to some degree.
Tori, thank you so much. Thanks for being with us. And I thank you on behalf of all of our members of the tourism industry on what you and U.S. Travel do on a daily basis for the industry.
Well, thank you. And thanks so much for your leadership. Really appreciate it. And the only reason my daughter probably hasn't snuck in today is I've sent her off to soccer practice. So she is outside.
well, we hope to see her next time. She always puts a smile on everyone's face.
All right, terrific. But I look forward to hopefully seeing you soon in person. And thanks again for all you do. And thanks for having me today.
All right, Tori, have a great rest of your day. Thank you.
Thanks. Bye-bye.
All right, that was Tori Barnes, and it was great to have her with us updating on U.S. travel. We're going to switch gears to our next speaker now. And I mentioned about Tori's time in Washington, D.C. Our next speaker spent the morning at the Chamber just last week, where she heard from members of the Hilton Head Island and Bluffton business community in a series of roundtable discussions. And in November, she was elected as the U.S. representative for South Carolina's 1st District, defeating the incumbent candidate. She's a businesswoman. She's also the first female graduate of the Citadel. What we found out is that she's a champion for South Carolina and for business large and small in Congress. I'm pleased to introduce to you our Congresswoman, Nancy Mace. Representative Mace, welcome and good morning.
Hey, good morning. And I know where I'm sending my children. I'm sending them to Tori's house for sure for soccer practice.
It's a good plan. I thought it was really interesting when you started off with us last week, just sharing about what you were doing in Washington and how things got started with the events that took place early on in your time there.
Right. No, January 6th was certainly a harrowing day. And in fact, just 2 weeks ago, I was having dinner. I had an evening out, personal night out, the only night I had that week, and I was going to take it. And I had someone approach me to dinner that night and said, hey, I need your personal email address, private email address, because I'm going to send you this video that proves that January 6th was a hoax. And I had to just get up and walk away because it just certainly was not. It was a very violent day in our nation's history. It was a day I never want to see happen again, and we had to take very seriously. And no one should have to go to work and then have to explain to their children at the end of the day that it is safe to go to work. And it was a very scary time, but also it's so important that we have strong voices too up in DC, and to not be afraid of leadership in either party, but to do the right thing. Especially in such an important time and in a crisis like that. And I promised the voters and constituents in South Carolina's 1st Congressional District that I would be an independent voice, that I'd be fiscally conservative, I'd protect their businesses and be pro-business and be pro-education, because when we have educational opportunities, job opportunities then follow, but that I would be that strong voice. And I've been that since the day I was elected. I am exactly what I told you I would be. And also I have an opportunity to be a new voice for the Republican Party as we look to rebuild over the next few years and figure out what does that look like. And I really, truly believe that as a nation, it doesn't matter if you're a Democrat or a Republican, but if we continue to make the conversation about one person and not about the American people, then we all lose and the American people lose. And so I'm really focused on trying to bring and drive that message home. I'm also a single working mom, and I have kids that are in virtual school. And so I really also understand that the pain and the pressure that working families are feeling right now under tremendous challenging times with COVID-19. And so those are really important. It's really important to have someone who understands the pain that we're all going through, business-wise, family-wise, et cetera, because the decisions we're making here in Washington, we want to make sure that they're very targeted to those who need it most. Did I lose you, Bill?
Nope, we're still here. We have you.
Oh, okay. Okay.
Yes.
I was taking a pause.
So tell us a little bit about where you see your time, short time in Congress, where it's been, and then kind of how you see leading your way through Congress and items that you want to be involved in, and maybe some bills I think you mentioned last week.
No, that's right. We have tremendous challenges. We have millions of people out of work. We have millions of kids that need to go to school, and we have millions of people desperate to get a vaccination. And that's really where all of our priorities should be right now. And so I've been a strong voice on reopening our schools. The federal government has given away $68 billion to expedite the reopening of schools, and only $4 billion of that has been spent so far. And they're getting ready to send another $150 billion that can't even be spent on schools in the next couple of months. It's going to be years before that money is spent. And so when we're talking about the issues that are most important right now, getting relief to those who need it, getting targeted relief. But right now we're seeing a lot of pork being spent. We're seeing a lot of money being wasted. We're seeing money being given away with very little reporting mechanisms, accountability, responsibility, or even transparency. So I've been trying to be a voice on those issues. One of the things that's also really important to the 1st Congressional District, I'm on 3 committees right now. I'm on transportation and infrastructure. And that is a committee that is tremendously important throughout the entirety of the district, because it extends not just beyond your potholes and roads and bridges, but it goes into the defense industry. It goes into our environment, our waterways, aerospace, you name it, financial services, and how those things get financed. But it's a very important committee for me to be on for the district, and I will do a lot of work there. That work should be, for the most part, nonpartisan. I'm hopeful in that, because it's not a Republican or Democrat issue. Infrastructure is an American issue. It's something that I think many of us can agree on. I'm also on HVAC, what we call HVAC, which is the Veterans Affairs Committee. And there are many veterans, not only that are starting businesses here in the community and have come here to retire and then continue to work. We just have a tremendous veteran community, particularly in the Beaufort County area. There are a lot there. So HVAC will be, the VA committee will be a great committee that is also represented in the district. And then I'm on oversight and government reform, which really goes into waste, fraud, abuse, investigations. I called for an investigation after the GameStop issues. Financial Services held those hearings, but we really can look at a number of different issues over there in oversight. So I'm really excited about all three of the committees. So some of the other things that I'm working on too is criminal justice reform. Criminal justice reform is an issue I worked on as a state lawmaker. And again, that is a very much a nonpartisan sort of issue. And I'm trying in the days and weeks following January 6th, because I was such a strong voice, I've had a lot of opportunity to work with members across the aisle. And I'm trying to find those opportunities. And one of those opportunities should come this week with a bill that I was the lead Republican sponsor on that will pass out of the House in just a few days regarding due process issues in our federal prison system. And so those are also issues that I'm working on. And obviously, I don't want to see our taxes raised in the middle of COVID or really ever, but especially not in the middle of COVID. But there's some measures that we're seeing financially that could have a negative impact on businesses. And I'm going to be a very strong voice against those measures, against wasteful spending, because every dollar counts. And if our businesses have had to cut back, so too should the federal government. But literally no one's talking about those financial issues whatsoever. And it's very concerning. And then the environment. The environment would be another area where I am looking to do some work, and I will be filing environmental legislation, particularly as it relates to drilling off our coast, but ensuring that people can get back to work, or kids can go to school, and people can get vaccinated. Those are should be our only top three priorities until we overcome COVID-19 also.
All right, thank you. Question from Robin, and Robin is asking, how can we overcome the partisan divide in Washington? And do you see any hope on that front?
Yeah, it's hard. When we had the budget reconciliation process, and there was all this talk about unity after January 6th that we would be working together. And the COVID package is totally partisan. The budget reconciliation, all of our amendments, not a single Republican amendment was allowed to pass. And that was, my understanding is that there were Democrats that also wanted to amend the legislation, and they wanted to work with Republicans, but they, quote, were not allowed to by their leader, by their speaker. And I hope that is not a sign of the days, weeks, and months to come, because I came up here to work. I am paid $174,000 a year to do a job, and I should be here to work with anyone who's willing to work with me. I'm willing to work with them. That's something I've been really pressing upon people. And I've been building relationships both with Republicans and Democrats. I don't care if it's my bill or my piece of legislation. I really I don't have any pride of authorship on any of the things that I want to pursue. It's really just a matter of getting it done. And if we can set our egos aside, if we can find people who really want to work together, then I do believe that we can get some of those things done and reach across the aisle, and know that I am building relationships with people in both parties, because that's what I promised I would do. I said I would do. And you'll see that. You'll see me pass a bill with members of the Democratic Party this week on criminal justice reform. So it's really important that I don't just talk about it, that I actually do it. And I find members who are willing to go there with me.
Thank you. Next question is coming from Ted. And Ted is just asking what your position is on the minimum wage issue.
I am against the government mandating a $15 minimum wage. So I am a fiscal conservative. I believe in limited government. I believe in competition. I believe in the free market. Supply and demand can dictate wages. So previous to COVID-19, within the 1st Congressional District in the Lowcountry, our unemployment rate was just under 2%, about 1.86%. And if you were, for example, in the food and bev industry, you were making, starting out entry level, between 11 and 15 an hour, and you had some additional benefits, childcare, for example. I know some restaurateurs and hotels had some of those additional benefit programs for their entry level employees. If you were working at a fast food franchise in Charleston, you were making $15 an hour, and you were about to get a raise to $20. So some of the issues with the $15 minimum is that number one, there's this domino effect. So the person making 15, then all of a sudden, when someone making 11 or 12 gets promoted to 15, the person making 15 says, well, I need to be making 18. Person making 18 says, well, I'm better than that person. I need to be making 22. And so there's a cost, an additional cost factor that federal government, that members of Congress aren't factoring into that calculation. And so when that happens, there are going to be fewer jobs available. And if you were making 15 and about to get a raise to 20, well, now that the government mandated $15 an hour, then that business perhaps wouldn't even have to give you that pay raise, right? They can just justify it. Well, the government mandated 15, that's all you're getting. And so we've got to make sure that, especially in a time where we have unemployment is an issue, particularly where we've been hard hit in the hospitality and travel industry, as you all know, in Beaufort County, it's everywhere in the 1st Congressional District. But the last thing we need to do is limit the job opportunities for people in this dire situation that we find ourselves. And then the other thing that I think is worth mentioning too, in addition to the minimum wage, the federal government is now going to increase the federal unemployment to 400 from 300. There is a loophole for workers. Once you get your stimulus check, sometimes they don't want to come back to work. And when they do come back to work, they want their exact same job, but they don't want it full-time. They want it now part-time because they can make more money with federal state unemployment benefits with their stimulus check and working part-time. So there are some loopholes in there too that we have to look out for businesses as well. And we need to incentivize people to be productive working members of society, not de-incentivize it. So that's my fear also.
Thank you for answering that. One last question. We know you've got a busy morning.
Yes, sir. I appreciate your
carving out
patience.
some time for us.
I got lost in the tunnels earlier, and then I was in a meeting, and I was like, oh my God, my phone was going to die. And I was like, so I appreciate your patience this morning and working with me.
Absolutely. Last question for you is it's coming from Randy, and Randy is asking, what do you see as the top priority in Washington right now?
Well, the COVID package is the thing that everyone is talking about and pushing that through. Unfortunately, it wasn't done in a bipartisan way, and you're gonna see some things within that bill that will raise taxes, that will be wasted spending, like for instance, over $100 million being spent in Nancy Pelosi's backyard for some type of rail to Silicon Valley, I believe. I mean, things that have nothing to do with COVID, and we could have done more with less. We could have given I believe a larger stimulus check to a smaller number of people who really truly have been negatively impacted by COVID-19. There's so many things we could have done that were not done. I have been really disappointed with the package, but that is the thing that everybody's talking about this week is the COVID-19, the next stimulus package.
Thank you so much for being with us, ladies and gentlemen. That's
yes, sir.
Representative Nancy Mace.
I appreciate you so much, Bill, and you have a great day.
You do the same. See you soon. Bye-bye. All right. Moving right along today with our continued stellar lineup of speakers. Our guest is certainly no stranger to our calls. When she speaks, we know one thing, and that's that South Carolina listens. And we're pleased once again to have with us the DHEC epidemiologist, Dr. Jane Kelly, to give us the latest news on the pandemic front. Dr. Kelly, I know your time is tight today too, and you're juggling us between a couple of different meetings. So we're delighted to hear from you.
I am juggling, but I'm very glad to be joining you guys. Let me just see if I can share my slides. I just have a brief update today. There we go. I hope people are aware that nationwide we are having a great decrease in the number of new cases. And I think some of that is a function of people being immunized, some people receiving vaccine. But I think the bigger picture is the fortunate decrease in the number of cases is because we had a huge surge in January. And I'd like to remind people by that blue line that I've inserted into this figure is that, yes, we're greatly coming down in the number of new cases, of deaths, of hospitalizations. That's terrific news. But what that really puts us is at where we were in July. Remember July? Everybody was worried because we had a surge. Our surge in January was just so much bigger. We are really back at that baseline of July. So I don't want people to be overconfident or over reassured. In South Carolina, we are still number one in new cases per 100,000 population. It's better. If you look at the figures on the graphs, the maps on the left-hand side of this screen, if you look at the bottom map, that is for the first 2 weeks of January. And we had, remarkably high number of cases. And then the top map is the past, the 2 weeks from February 6th through 12th, still in the red zone, but better. So we're moving in the right direction, but I don't want people to feel overconfident. Also, I think you're aware that in South Carolina, we have not only the B.1.1.7 or the UK variant and the B.1.351, the South African variant. Those variants are not more lethal, but they are more transmissible. And what that means is people remain infectious, they remain contagious for a longer period of time. It's estimated about 5 days longer for British. I don't know for the South African variant. I don't think that's been measured. But we have both, they're more transmissible. I do want to introduce you to our South Carolina vaccination dashboard. There is more information being added to this, more tweaks to this every day, but this is what's currently available. So if you want to find this, I've got the URL down there on the bottom of the slide, but also if you just Google DHEC vaccination dashboard, it'll bring you to this page. It indicates in the upper left corner the number of doses of vaccine that have been given in South Carolina. But remember, the Pfizer and Moderna vaccines are 2 doses. So 831,000 doses given, but some of those are second doses. So we've got about 600,000 people vaccinated in South Carolina thus far. These data are updated not every day on this vaccination dashboard. They're updated several times a week. So it's some of the things that you can look at, and I'm not going to show you this in real time, but if you go here, you can play with this a little bit. You can hover or click rather on, for example, people with 1 dose of vaccine versus 2, or male versus female, or any of the race, ethnicity, or age groups to receive a dashboard that just shows the data for that subgroup. So as you can see at a glance, far and away, the largest demographic that has been vaccinated in South Carolina thus far are white females over the age of 65. And that makes sense. Think about who we vaccinated first. We vaccinated workers in healthcare settings. And it's estimated in South Carolina that that's 75 to 79% of our workforce is female, because it doesn't just include doctors and nurses, it's nurses' aides, it's a number of other entities. Plus also, when we consider age 65 and over, we're talking about nursing home residents. Women live longer than men. They are a higher proportion of the nursing home residents and staff in long-term care facilities. The younger age groups that are represented here, those who were vaccinated who are under age 65, are mostly workers in healthcare settings. A few other special individuals, but they're largely workers in healthcare settings. Also on this dashboard is an indication of the vaccine count by county of administration. So you can look at your particular county to see how many vaccine doses have been administered in that county. Now, that doesn't necessarily mean that the person vaccinated was from that county. It means where the dose was given. So for example, you look at Charleston County, they've given the highest dose number of doses in the state, but not all to Charleston County residents. People have traveled to, for example, to MUSC or to Roper to receive vaccine. The other thing that you can do, I don't know if it really shows well on this slide, I may have cut it off. You can look at vaccine administered in South Carolina by recipients state, because there has been some concern expressed that, well, what about the people who travel across the border, for example, from Georgia or North Carolina and get vaccinated in South Carolina? Is that fair? Should we be doing that? In South Carolina, we have not been asking for proof of permanent residency. So people who live here part-time or people who are here right now visiting can be vaccinated in South Carolina. But it's really a break-even deal. There's a certain number of people in other states who have been vaccinated in South Carolina. What this doesn't show is the flip side, that the number of people who are South Carolina residents who have been vaccinated in other states is in fact a little bit higher than the number of people who are non-South Carolinians that we vaccinated here. So I think that the feeling of there's competition for vaccine, it's about a break-even deal for South Carolina. If you want to know more about the dashboard and how, where do these numbers come from, understanding, you can click on the Understanding the Vaccination Dashboard. It'll bring you to a page like this. I'm not going to read through all that. And there's more information on this page about understanding the vaccination dashboard. But where do these numbers come? And one of the concerns is these numbers don't always exactly match up with what's on our vaccine dashboard, where we indicate the number of doses, for example, of Pfizer and Moderna vaccine that have been given. And part of that is because these are updated at different times. So the numbers are not going to exactly match up, but they're close, but they're used in different ways. So I just don't want people to be dismayed that the numbers aren't exactly the same. I want to finish by addressing a concern I have heard that if we're supposed to reach 70% herd immunity before this thing slows down, how can we do it if we don't have a vaccine for children and there are people who don't want to be vaccinated? This graph shows the results from a nationwide commercial laboratory Sero Survey. What a Sero prevalence survey is, this is done at CDC. They take a random sampling of tests where people have been tested for antibodies, and those who are positive by which state are put into a model to estimate how many people in that state are probably have been exposed and have antibodies. Now, this figure that I'm showing is just data through the end of December. So this does not reflect that big surge in January. So this is a really minimal number. And for South Carolina, based on this Sero prevalence survey, it was a little bit more than 13% of people had antibodies to COVID-19. I say that's an underestimate for several reasons. One is this still only includes people age 18 and over who could consent to doing a survey like this. So we do not have this sort of information on children. And as we all know, children are much more likely to have asymptomatic disease and may never have been tested. Number two, this is only through the end of December, doesn't reflect that big January surge. So it is likely that the Sero prevalence, number of people in South Carolina who have antibodies to SARS-CoV-2 is much higher than this. And to put it in perspective, we have had almost 500,000 people diagnosed with COVID-19 thus far in South Carolina. And surely that's an underestimate because there are people who don't get tested even if they have symptoms, and there are people who didn't have symptoms and are unaware. If we say even double that, which is, it's probably much more than just double that amount of number of people who have been infected. It's probably 3 or even 4 times higher. But if we even just doubled it, that means 1 million people. That means 20% of people in South Carolina who have antibodies to COVID-19. So that puts our herd immunity, even without vaccine, up to 20%. So that's a start. But as we roll out vaccine, we'll have that many more people achieving antibody immune response, and not just antibody, the other cellular components of immune response. So lest you feel like, gee, this is futile. What are we going to do if we don't have a vaccine for kids and there are people turning down the vaccine? We're never going to hit 70%. That's not true. Remember that herd immunity is vaccine, but it is also people who may have been naturally infected. We are still encouraging people who had COVID-19 to get vaccinated because the neutralizing antibodies, the immune response that is mounted by vaccine is even greater than that caused by natural infection. So we're still encouraging people to get vaccinated even if they've had disease. But I wanted to give you that encouraging picture of we're getting there. Thank you.
Dr. Kelly, thank you for sharing that. I know your time is limited. Just a couple of quick questions. One is from a listener. that is asking, that's saying, I'm scheduled for a vaccine on March the 24th, but I'm currently battling COVID. Should I still get my vaccine?
You should still get your vaccine. You don't want to get vaccine if you're feeling ill. So if you're still feeling ill on March 24th, you should reschedule. But yes, you should still get your vaccine. If you were feeling ill, or if you just felt nervous or something about receiving the vaccine, CDC considers it okay to wait 90 days after infection, because reinfection during that 90-day period is rare. But it would be safe for you to go ahead and get your vaccine on March 24th, as long as you're not having fever and you're feeling generally well. You don't have to be, if you're still feeling a little fatigued, that's okay, but you don't want to get it when you have fever.
Dr. Kelly, I know you need to run. Thank you so much for squeezing us in today. Your updates always mean a lot to us, and keep up the good work. Thank you so much.
Thank you. If you've got questions, you can email me.
Okay. Thank you. Again, that was Dr. Jane Kelly. We're going to focus on a local update and a local perspective on vaccine deployment, as well as the testing efforts of the overall pandemic response in Southern Beaufort County. And we're fortunate to have back with us again today the market CEO of Hilton Head Regional Healthcare, our friend Jeremy Clark. Jeremy, good morning.
Hey, good morning, Bill. How are you today?
Very well, thanks. Nice to see you.
Good. Great to be back here. Appreciate it. Just to start off, I want to give everyone an update on what we're seeing here locally in Hilton Head Hospital and in Coastal Carolina Hospital today. We have a total of 10 COVID positive patients hospitalized, with 3 of those in the intensive care units. If you've been on this call before, you know that number's a lot lower than I reported a few weeks ago, and definitely lower than the number back in the peak of January. So to echo Dr. Kelly's statements, we're currently trending in the right direction, which is certainly encouraging, and we currently have capacity in our med surg and in our ICU beds. I'm going to give everyone an update on vaccine distribution here locally to date. To date, we've given over 15,000 vaccines, our 2 hospitals have, and we expect that number to grow significantly in March and then later on in the spring. We are very excited that more providers continue to come online, so the pharmacy, the grocery stores. That's exciting to see, as we really do expect vaccine quantity to increase in March somewhat, and then hopefully continue to increase as we go into the spring and then the summer. So if you're over 65 and want to make an appointment, you can certainly start at our website and start the process of making an appointment at the hospitals. But I'd also encourage you to keep an eye open on local media reports of new providers that are coming online. It seems like every week new organizations are coming online offering new appointments, and you may be able to get an appointment sooner at one of those locations than you can at one of the local hospitals. And really, the sooner that you can get an appointment for any vaccine, whether it be the Pfizer vaccine, the Moderna vaccine, or hopefully soon the Johnson & Johnson vaccine, that's the better for you, and it's really the better for all of us. So I'd certainly encourage people to continue to keep their eyes open for new appointment opportunities. Right now, the number one challenge is the supply of vaccine. And just very simply, there's not enough vaccine to meet the demand that we are seeing locally, across our state, and nationwide as well. So right now, hospitals are not getting all of the vaccine that we order in order to take care of all the appointments that we have scheduled. And we know that this has led to some cancellations and some rescheduling of appointments. It's very frustrating to be a part of that. But I will tell you, it's not unique to South Carolina. This is something that's going on across our country right now. But if your appointment is canceled, I would ask you to work with the provider that you were scheduled with to get rescheduled, or hopefully get called back soon. I will tell you that we're working very hard for any appointments that we had to cancel. We're working very hard to get you in the next week, if at all possible. It may not be possible, but if all possible, we're really trying to get people in the following week. I also want you to know that we understand the anxiety and the frustration that appointment cancellations cause. We understand this with first dose appointments, but even more so if a second dose appointment is canceled. But I also want you to know that the CDC states that the second dose can be effective if it's administered up to 6 weeks after the first dose. So right now, we've been trying to get everyone in right at 21 days after that first dose. But the CDC's guidelines state that it can be effective if administered up to 6 weeks. So being rescheduled a week later, or maybe even 2 weeks later, is still within these CDC guidelines. Again, right now, I just echo the governor's request and our national leaders' request that everyone be patient with this process. We do believe that South Carolina is getting its fair share of vaccine. And I can tell you firsthand that the providers in our community, the hospitals and the pharmacies, are doing a great job of getting that vaccine in the arms of the people who need it. So we know that part of it's working. We're continually refining our processes to get better. That may include changing of hours and changing the locations as we go through this for us. These processes are new to the CDC, they're new to DHEC, and they're new to us as well. So just ask everyone to be understanding in this process and know that we are trying to get to everyone and vaccinate everyone we can as expeditiously and as safely as possible. It's just right now there's a very limited amount of vaccine, but we expect this to improve in the coming months. We saw improvement from January to February and fully believe that we will continue to see improvement from February to March and then March and beyond. So Bill, to wrap up, I want to remind everyone that our hospitals remain ready. We have created a safe environment to provide care. We are providing care to COVID patients, as I mentioned earlier, but the vast majority of our patients are not here receiving care for COVID today. We're working very diligently to expedite the vaccination process. We appreciate the leadership of our local officials and our state and national officials as well. And we appreciate everyone's support for our caregivers. So Bill, I will turn it back over to you, and I'll see if there's any questions that I can answer.
All right, Jeremy, thank you. And there are a couple of questions. One is from Jim, and Jim is asking if you know a time frame when those under 65 will be able to get the vaccine.
Yeah, it's a great question, and right now we do not have a firm time frame on that. There have been a lot of discussions about other groups outside of the 65 and older crowd getting vaccinated, but nothing firm has been decided on that. So I would just tell you to stay tuned. Hopefully, as vaccine supply increases, we'll be vaccinating more and more of the 65 and over crowd, and we can move on to the next phase.
All right, next question is coming from Julie. And Julie is asking if, since there are fewer tests being taken, has turnaround times and for results gotten quicker?
Right now, we're seeing the turnaround time for COVID testing results coming in right at 24 to 36 hours, which is pretty good. If you'll recall, back in the summer, that was stretching much longer. So we're encouraged by that. And to reiterate your point, we have seen a significant decline in testing. But the demand for testing, but the good news is we're also seeing a decline in the positivity rate, or the percentage of patients that are testing positive for this in the community. So those are both encouraging stats.
All right, thank you. Our last question, Jeremy, is asking when do you expect the time frame to see the Johnson & Johnson vaccine on the market?
It looks like, with some news as recent as this morning, it looks like that vaccine will be hitting the market very soon in the month of March. And J&J's projections, I read, they're expecting to have 20 million doses available of that vaccine in the month of March. Now, that's 20 million doses for all providers, across the country. But that's 20 million more doses than we had in the month of February. So I'm encouraged by that, and expect to see continued increases in production from Pfizer and Moderna as well, along with the J&J vaccine coming online. We're encouraged and optimistic about the coming months, but as of today, it's still the shortage is still a major issue for us.
Jeremy, thank you for joining us again this morning, and we always appreciate your updates.
Bill, thank you for having me. I appreciate being here.
All right, that was Jeremy Clark, and the market CEO of Hilton Head Regional Healthcare. Our next guest moved to the Lowcountry from Winston-Salem, North Carolina, where he oversaw over $679 million in community grants from the Winston-Salem Foundation. And we're very fortunate to have him now as the president and CEO of the Community Foundation of the Lowcountry. And the Community Foundation has been at the forefront of lifting up those in need when the Lowcountry community and with the Lowcountry community COVID COVID-19 response fund. Our community has raised more than $654,000 to deploy to 41 frontline nonprofits in our area. Unfortunately, the need hasn't gone away, and the need continues to grow every day for pandemic relief. Here to talk with us about what the Community Foundation of the Lowcountry is doing and what they have on the horizon is its new president and CEO, Scott Wierman. Scott, welcome, and we're glad and delighted to have you on Hilton Head Island.
Well, thank you, Bill. It's a pleasure to be here, and I've enjoyed my first couple months here in the Lowcountry and getting to meet a number of folks, and look forward to continuing to do that. As Bill said, it's hard to believe it's been a year now. March will be a year since the Community Foundation of the Lowcountry established the Lowcountry COVID-19 Community Response Fund. And its purpose was to provide resources to community-based frontline nonprofits that are addressing issues related to COVID-19 in Beaufort, Jasper, Colleton, and Hampton counties. As Bill said, the community has been extremely generous since March of last year. Over $655,000 now has been awarded to nonprofits that are on the front lines working with individuals who've been impacted directly by the COVID-19 virus. The foundation had, because we've still been fortunate to have some individuals to continue making some gifts, we ended up with a few extra dollars, and our staff put out a call for proposals earlier this year to say, we have a little bit of money left, let us know if you have ongoing needs. And I think to say that we were overwhelmed with the responses would be an understatement. We ended up receiving 35 proposals across the 4 counties with total request of about $600,000 in needs. And yet we had just under $100,000 to award. So we have a committee, an advisory board of representatives, volunteers from each of the counties that have overseen the grants process and have made the funding decisions on how to allocate those resources. They met again last week and made the determination last Friday, actually. They were able to award the roughly $99,000 that went out the door. And yet we are faced with the reality that there is still a huge gap between the resources that are currently on hand and those the needs that are out there. The focus and the priority has been determined to be food and shelter, emergency shelter in particular. What we are hearing from a number of our partner agencies that are on the front lines is that a number of those agencies that historically have been the beneficiaries of donated product have met increased challenges as grocery stores have had their own challenges, and more folks are shopping in stores, and therefore there's less donated product available. And of course, the restaurants obviously have a very different set of challenges as well. So we put out a release last Friday or last Thursday afternoon, and just told the community of this challenge. We're thrilled that over the weekend and through yesterday, another $31,000 has been contributed. And those funds will go out immediately to those organizations who did not get funding, but who were prioritized, again, in the focus areas of food and shelter. And so we are happy to receive additional contributions over the next couple of weeks. We're receiving checks. People can go through our website. We would just ask that you indicate on your contribution that it is intended for the COVID-19 response fund, and we'll be happy to put that money back out into the community very shortly so that individuals that have been impacted can be helped. I would also just say, if you happen as an individual or as your business has a donor advised fund here, it's a simple transfer. You can be in touch with our staff, and we're happy to transfer that money internally. And then finally, Bill, one other thing I would just mention in addition to the COVID-19 response fund is that we are partnering with about 10 other foundations across the state of North Carolina to do a study, a survey of the impact of COVID-19 on the nonprofits sector in the state. And we should have those summary findings by like the 25th of March, and we'll be happy to share what we have learned as a result of what's the impact has been on our sector. So again, we are very appreciative of the community support. This foundation has contributed $200,000 of that $655,000. And we're just very grateful for a very generous community that is looking out after its neighbors. So thank you, and be happy to entertain any questions.
Scott, thank you for that update. We do have some questions for you this morning. First one's coming from Rick, and Rick is asking how residents can donate to the fund. I know you mentioned a check and sending that in with the specifications on it. Is there an online mechanism as well?
There is. You can go through you can go to the Community Foundation's website, and you can do a credit card gift. That's easy to do that, and just you can designate it for the COVID response fund. But we're getting checks and also online contributions, and we're happy to receive either.
Thank you for that. Randy's asking, do you see the tide turning to the positive in the need for food and shelter in the area?
Well, unfortunately, right now we don't. Now, let's hope that there's obviously, as we've heard this morning, encouraging news about the trends in terms of infections. Hopefully, the employment numbers go back in the right directions. People are able to get back to work, but there's going to be a little bit of a delay, and I'm hoping that maybe we're seeing the worst of it right now. But until people have opportunity to go back to work, I'm afraid that this challenge is going to remain with us for a little while.
Thank you for that answer. And Jennifer is asking, what are you seeing as the most pressing need right now for those dealing with pandemic challenges?
Yeah, I would go back. I would say that again. I think what the committee prioritized is food and kind of emergency shelter. Those are the most pressing needs, and I think we were actually overwhelmed with just the number of proposals that we received from these agencies that focused on food, and we made that a priority. That's not to say that there aren't other needs related to education and other challenges, but the greatest need right now and what we want to respond to as quickly as possible is around food insecurity and shelter.
Scott, thank you so much for being with us today. Thanks for the great work you're doing at the Community Foundation, and look forward to getting together with you soon.
Great. Thank you, Bill.
All right. That was Scott Wierman with the Community Foundation of the Lowcountry. And as we transition into our next speaker, I can't let the moment pass without saying happy birthday to Connie Ann Kilmar. Today's Connie's birthday. She's been a great teammate here at the Chamber, and she'll be celebrating her 29th anniversary at the Chamber in June. So couldn't let the moment pass again without wishing a big happy birthday to Connie. Many of you know her and the great work that she does and the valued team member she is at the Chamber. Well, our last speaker is certainly no stranger to the Lowcountry, and just wanted to, start out by saying thank you to a good friend and a good leader, and that's Marc Orlando. Marc served for 14 years at the town of Bluffton and was the town manager there, and now is on day 3 as the new town manager for the town of Hilton Head Island. And he and his wife, Jackie, along with their 2 kids, Emmy and Ben, they've been part of the Lowcountry, and certainly the Hilton Head Island community is delighted to have him serving now as the Hilton Head Island town manager. Marc, welcome. I know it's the 3rd day on the job, not much probably to update on, but wanted you to say hello to everybody and anything else that's on your mind.
Yeah, good morning, everybody. Bill, can you all hear me okay?
We sure do.
Good. I realized this morning I forgot my Zoom password as I switched computers. So other than that little snafu this morning, it's been great. It's been smooth. It's my 3rd day. I just had a recap with our HR director and our deputy town manager, Josh Gruber and Angie Stone. Just really starting to talk about the organization. I've been here in the Lowcountry. It's a bit surreal. I arrived working for the town of Hilton Head. Steve Riley hired me. I worked for Sally Krebs in 1997, in the summer of 97 as an intern. So it's surreal, but I'm really honored to be back. I'm excited to work for town council. We had a workshop yesterday, my first workshop with them, and we talked about the Parks and Rec plan and how it relates to the comprehensive plan, really titled Our Plan. And we really talked about what's next to implement the Parks and Rec plan. And so that's not a bad start to your second day, really getting our arms around, what's next with our next amazing park, amongst a whole bunch of other initiatives. I'd say one thing, and I think that since I have a bit of time to just say hello, there's a void in the organization, definitely with Steve's retirement and Charles Cousins' retirement. The town manager retires, the planning director retires, and everybody's friend, Scott Liggett, engineering director, been here 30 years, is untimely passing. So there's definitely heartache amongst staff. So I'm happy to be here now to help as much as I can and really just do my best to stabilize the organization, provide that leadership. And I can't say enough, I'm grateful for town council that they trust in me, and I really have a great appreciation and respect for all of them as a unified body. And so I'm excited to get to work, Bill. I'm excited to work with you and the Hilton Head community. I know Jackie's really excited, and I have a lot of thanks for Bluffton as well. So the transition has been great. It's been more than what I expected, and off to my third day.
Mark, I like what I see in your office, the 50th anniversary of the Heritage Coca-Cola bottle.
Oh, you can see that, yeah.
We had it at the Chamber Ball that year, and I think it looks really good sitting there.
Absolutely, and my new coasters. Look
at that.
So I haven't even had my whole office set up yet. I'm getting a desk delivered Friday, and figuring out how to log in to different passwords, but really spending a lot of time with this amazing staff, great team, a passionate and caring staff. You can really tell, you can just sense it in the organization as you walk through the halls. People are really interested, not only to just say hello, they're interested to let you know what they're working on and what they do and how long they've been here and how much they love the island. So it's great to dive into the organizational culture in that respect. So yeah, I have a few heritage things that I'm starting to display, Bill. Well,
good. And on behalf of the Chamber and the business community and the residents, welcome. And we're glad to have you in this post.
Thank you, sir. Thank you, everybody.
All right. That was Hilton Head Island's new town manager, Marc Orlando. That's going to conclude our call today. We appreciate you being with us. Our next call, we have some remarkable speakers as well. And as we close today, I'll certainly remind everyone to please be safe, stay kind, and wear your mask. Have a great rest of your day. Bye-bye.